Hello, this is Governor Ron Desantis. I'm here with Florida Surgeon General Dr. Joe Ladapo. We've got a really exciting set of announcements today. One of the things Florida did early on in COVID was provide liability protection to businesses and nursing homes so they wouldn't get sued over COVID. And we think that that was something that was important to keep Florida open. And so we were concerned that if you didn't have that, then a lot of businesses would clamp down and have really severe mitigation for fear of litigation. And so we've been able to extend that, but at the same time, as we looked at how that was structured, we noticed that a lot of it referenced official guidance from different government or professional organizations. And Joe Ladapo and I discussed how a lot of that guidance isn't really the best guidance. And so we have huge updates today on really significant matters. The first thing is under Dr. Ladapo's leadership, the Florida Department of Health is officially providing guidance to businesses recommending against forced masking of employees. And so you look at a lot of retail establishments, you look at a lot of hotels, resorts, restaurants, they will require these employees to wear masks, even though hundreds of people in the establishment will not be wearing masks. And there's just no evidence that that's something that's been beneficial. And obviously, it's terribly uncomfortable for the employees. So Dr. Ladapo, can you talk a little bit more about your guidance recommending against these corporate forced masking policies for employees?
Oh, thanks, Governor. You know, I think so many of us are happy to see the end of employees having to walk around with masks in hot restaurants when everyone else is sitting comfortably. So there's never been any evidence that this has benefited employees. There's never been any evidence that it benefited patrons to businesses, and we're not recommending it here in Florida. And we just have to make decisions like this when the CDC unfortunately has become politicized and is not making decisions that are reflecting the highest quality evidence.
Yeah, I mean, look, at the end of the day, these health protocols are based in evidence, but we have no need for any theater in Florida. And so if you're forced masking employees just for the appearance of safety, that is not a sufficient justification, and you're not doing best by your employees. The other thing that we've updated is some of the treatment protocols that have been out there. I mean, if you look at like Fauci, what he puts out and says what you could do, he's been very negative on a lot of treatments that have actually shown positive results. And so what Dr. Ladapo has done is made sure that practitioners understand, that they have the flexibility and they can use their judgment to use off-label products in order to treat COVID-19. And so you can talk a little bit more about that?
Thanks, Governor. It's really been a tragedy that my physician colleagues, have decided that it's more important to stick with whatever the CDC or Dr. Fauci is saying than relying on their clinical wisdom, experience, and scientific expertise, which is what doctors usually do. So now doctors who practice medicine in the way that they think is most appropriate for their patients, when they receive pushback from hospitals, we have an avenue for them to file a complaint with our Agency for Healthcare Administration that the hospital is interfering with their ability and their clinical judgment in terms of what's best for their patients.
Absolutely, and we want people to be able to have a right to access these medications, especially if they're in a situation where nothing else has worked, and so we really appreciate you doing that. We also have really led in Florida, first on keeping kids in school. We were sued to close the schools in the summer of 2020. We kept them in person 5 days a week. We made sure that kids could go to school without being forced to wear masks for 8 hours a day. Many school districts across the country still to this day force mask these poor kids. And under Dr. Ladapo's leadership, we were one of the first states in the country to get rid of what is called healthy quarantines, where you would be in the lunchroom, someone else happened to test positive, and they're sending these healthy kids home to basically sit for 14 days, and many of them never test positive for COVID. So that has been a boon for parents. It's been great for kids' education to keep them in school. But what we also noticed that even if you test positive, that isolation period should be grounded in science, and it shouldn't be too long. And that's not just K-12. It's especially important in daycares. We've had kids isolated in daycares outside of daycare for 2 weeks, and the parents are having to go to work. So what the Department of Health has done with Dr. Latipo is they've updated the daycare and school guidance to isolation to 5 days. Because you talk about that?
Oh yeah, and really, the governor is being modest here because these measures actually predated my joining his administration. So the governor, fortunately, has been forward thinking about what kids really need and what's best for kids. And this is another step in that direction. So we're down to 5 days. So 5 days of quarantining for people who test positive. And this goes for, as the governor said, for the little ones, our toddlers in the preschools, and our older children in middle schools and high schools and elementary schools. And it's based on science. So you look at the data on when people are transmitting virus to other people, and almost all of it happens before the 5th or 6th day from the day that they have symptoms. Almost all of it does. So there's no need for people to be staying in at home or and inconveniencing the family and all that stuff. Beyond that, and I'll add the other thing, which is for anyone who's complaining about this. Please remember that these are the same people that fired doctors and nurses who didn't get a vaccine, but asked doctors and nurses who tested positive and had the vaccine to come into work. So this is common sense, very practical public health.
Yeah, and if you think about the disruptions that's happened over the last 2 years, and when this first started, someone tested positive, they'd be out 14 days, but then they'd have to test negative twice to be able to go back on the job. The problem is with these PCR tests, you can keep testing positive with the dead virus there. So you're not contagious, you're not transmitting to anyone, you're not sick anymore, and yet they were stayed out. So some people would stay out for weeks. Beyond even a normal isolation period. And so what this does is really recognize reality. So important for parents and students, but this is also something that is being updated for the public at large with the isolation time, correct?
That's right. That's right. We're putting out general guidance for the population that 5 days is all you need unless your symptoms are continuing, in which case you really should be seeking medical care. Obviously, our message about treatment is going to continue. We want people who are high risk to receive treatment, but these prolonged isolations, they're really not benefiting anyone, and they've been very harmful, and there's a lot of data to show that in terms of the psychological, the emotional harms from long isolation.
So one of the things we wanted to do for both our healthcare practitioners, healthcare institutions, but obviously just run-of-the-mill businesses and schools is provide the most up-to-date, sound guidance that's actually grounded in the data and in the evidence that we've accumulated over these last nearly 2 years. Simply relying on outdated CDC guidance when the experience has completely undercut that is not really a reasonable thing to do at this point. And so this is the fresh guidance. And so for all the businesses, we are recommending officially against forced masking policies, particularly for retail workers and for people working in the services industry and our hospitality industry. Every time I go to these places, I'll be in these big events, and you have all these people having such a good time, and the poor servers are forced masks. And I will ask them, are you allowed to take the mask off? They say, not yet. They're all waiting for it. They all want to be liberated. They want to be treated normally. And in Florida, yes, this is based on science and data, but it's also the case that when you have health guidance that conflicts with the data, that has the effect of creating a two-tiered society, that is harmful as well. And you don't want to have instruments of public health marginalize different communities of people based on their occupation or vaccination status or anything like that. So we're proud to be leading the way yet again. I think this will make a positive impact. And so I want to thank you for being on the ball on this and putting out some stuff that I really think will help an awful lot of people in the state of Florida. So a parting shot from you.
Florida is the land of the free. And I wish there was more, and I hope more states take the same path. But we are going to stay free in Florida.
Absolutely. So this guidance will be put out momentarily. It'll be disseminated across the state. And obviously, we hope to see a lot of folks complying We don't want lawsuits. We don't want people to be sued for just running normal businesses in case someone catches a respiratory virus. It's not something that you can just simply stop. We understand that, and we think those lawsuits wouldn't make sense. But at the same time, we want all of those institutions to be following sound guidance that's in the best interests of their institutions, their employees, and in the state of Florida. And I think we've delivered that here today. So thanks, everyone. God bless you.